All right, so with the new variant comes new questions. So joining us to answer these questions about Omicron is Chief of GBMC's Division of Infectious Disease, Dr. Theodore Bailey. All right, so thank you for being here. So we've been hearing a lot about this. How are the Omicron COVID variant symptoms different than Delta? And why does the Omicron variant make some people sicker than others?
Well, the symptoms that seem to be more common with Omicron than with the other versions of COVID is that there's more of an upper respiratory component to it. So there might be more sneezing, more sinus congestion, more runny nose, more sore throat, and less commonly than in the other variants, the severe lung infections. But we still do see the severe pneumonias in some of those patients. So it's still a variant of high concern, and it's very contagious.
For sure. So can you define mild, moderate, and then severe COVID?
Sure. I would define mild, and you're going to see a variety of definitions, but I think the most workable one is mild is going to be people who feel ill. They don't feel well, but they're not requiring additional oxygen. So they have, they may have the aches, they may have fatigue, they may not want to get out of bed, they may have all this upper respiratory stuff, they may have a cough, but they're not requiring hospital level care. When you get to moderate, you're talking about somebody who that's progressed to the point where they're going to need extra oxygen. And hospitals can give people extra oxygen in a variety of ways, but they don't need that much extra oxygen yet. There's somebody they can sit in a hospital bed. There's not someone always around them. They've just got some extra oxygen on, and it gives them time to recover. And then when you get to severe COVID, what you're talking about are people who are going to be in an ICU, who might have a mechanical ventilator or very heavy levels of oxygen added to what they're doing. They may need other kinds of help. Other organs may fail. We see kidney failures. We see clots forming that shouldn't be there that block circulation. So we start to see a lot of organ failure in the severe COVID. And that's really the spectrum that we deal with.
For sure. So it can certainly span more than respiratory symptoms. So what should patients do once they see signs of having COVID-19?
Well, that question has new answers within the last week. So within the last couple of weeks, there's been FDA emergency use authorization for pills. There are now outpatient pills that can be used to treat COVID within the first 5 days. Now, these pills really should be used by people who have some risk factor for getting into the moderate and the severe versions of COVID. So these would be people that have other existing health problems, heart problems, lung problems, kidney problems, or people of an advanced age. Then another option is through the convention center field hospital, which is still there in a limited capacity. They can get infusions of monoclonal antibodies. And there's a few centers around the state that can do those infusions. And all of those things, the pills or the infusions, can help people prevent getting into the hospital and getting into severe cases of COVID.
For sure. Dr. Bailey, always so knowledgeable, and you explain it in layman's terms. We appreciate you being here. Thank you.
Take care.